Hello, welcome. My name is David Border. I'm putting together the video series here. This first video is about myopia. I'm currently seeing patients inside the Danville Costco. Here's a picture of me with Everett going on a hike there. Beautiful day. UC Berkeley Optometry 2012. Video here is about myopia. So what I did is searched a Google search for myopia. The top result pulled up this mayoclinic.org, and so let's go through it. Nearsightedness or myopia is a common vision condition where near objects appear clear but objects farther away look blurry. So how far away exactly is going to depend on how much myopia you have. But if you're -2, then you might have trouble seeing a desktop computer a little bit. But the most blurry part of the vision for a patient with myopia is the extremely far away vision, so 20 feet or farther, and that's where I usually will talk about driving vision, looking at street signs, things like that. Myopia occurs when the shape of the eye causes light rays to bend or refract inaccurately. Okay, light rays that should be focused on nerve tissues at the back of the eye and the retina are focused in front of the retina instead. Here is a picture of a normal eye. Here light is coming from the right side and focusing right on the focal point at the macula. This is a nearsighted eye. Light is coming from the far right and it comes to a focus at the focal point in front of the macula. So it didn't make it all the way back there. Here's another example, light coming from the left, focusing in front of the retina. This is what would normally happen if the light comes into focus and there's nothing there. It continues out of focus. The light diverges. By the time it hits the retina, you have out of focus information. Here is, again, a normal eye. Parallel light is coming in, focuses right on the retina. An eye with myopia, parallel light coming in, focuses in front of the retina. We put a negative powered concave lens in front of the eye. It's going to focus it back onto the retina there. Nearsightedness usually develops during childhood and adolescence, and it usually becomes stable by about 22 years old. Then again, you'll have some changes to the vision around 43. Usually those changes are not myopia, but presbyopia. Myopia does tend to run in families. A basic eye exam can confirm nearsightedness. You can compensate for blurry vision with eyeglasses, contact lenses, or refractive surgery. You would need an ophthalmologist in California to do refractive surgery or LASIK. Symptoms of nearsightedness: blurry vision when looking at distant objects, the need to squint or partially close the lids to see clearly, headaches, eye strain. Children may have difficulty seeing things on whiteboards or screen projections in the classroom. Younger children might not express difficulty seeing, but they can have the following behaviors: squinting often, unaware of distant objects, a lot of blinking, a lot of eye rubbing. From my experience, that's more likely allergy. Sit close to the television. Adults, difficulty seeing street signs. When to see a doctor. If you have any signs of vision problems, or if a teacher reports possible problems, teachers are great at screening and noticing when children are squinting to see the board. Make an appointment for yourself if you notice a change in your vision, have difficulty driving, or you have a reduced quality of life because of your vision. Okay. A little bit separate from myopia here, emergency medical care. If you experience the following: all of a sudden you see a lot of floaters. Those are tiny specks or lines, or I say tiny little shadows, shapes of shadows that seem to drift through your field of vision. Flashes of light in one or both eyes. That could be something happening on the retina. Curtain-like gray shadow covering all or part of your field of vision. That sounds very ominous. Shadow in your outer or side vision. These here are signs of the retina becoming detached from the back. So this is a medical emergency requiring prompt treatment. high myopia, -6 or higher, is associated with an increased risk of retinal detachment. And this is a good point. I think we see a lot of patients that are -6 and above for annual exams for contact lenses or glasses exams every year or two. And we always want to check the retina, whether we're doing an optos photo or we're dilating the eyes to look inside. It's very important we're looking because if we detect a detachment or a break in the retina, an area susceptible for detachment, if we detect that early, we can send you in and do simple preventative treatments to avoid an absolute headache. If we don't notice a problem until after the fact, it is a medical emergency. Depending on how long it takes a patient to get in to see a specialist or into the emergency department, you could lose your vision if you wait a day. And so these are things we take very seriously. So you can understand a little bit the doctor's concern for the patients with a lot of myopia and the sort of urgency to check things completely. Again, that's with high myopia. So regular eye exams. The AAO recommends regular vision screening for children. The pediatrician will do something simple check at birth, maybe again between 6 and 12 months. Between 12 and 36 months again. If there are any problems, you may be referred to a medical doctor specializing in eye health and care, ophthalmologist or optometrist. Vision screenings are to check for vision problems. A screening test can be performed by a pediatrician, ophthalmologist, optometrist, other trained provider. Vision screenings are often offered at schools or community centers. The recommended times for screening, once between 3 and 5, again around 5, and then once a year through the end of high school. If a problem is identified at a screener, then you need to schedule a complete eye exam. Now, some patients come in and they're not doing any screening, their kids are not doing that anywhere, so then we may just do a complete eye exam at 5, 6, and annually till about 18. For adults, the AAO recommends, with no known problems with the vision, a complete eye exam. And by the way, when we say complete eye exam, that means checking the retina. That means checking your eye pressure. A lot of patients, oh, please don't do that. Please don't do that. Well, if we're checking that once in all of your 20s, it's very important that we check everything. At least twice in your 30s, every 2 to 4 years from 40 to 54. Now, where can adults get vision screeners? That is more tricky because the elementary school screeners are pretty reliable and great. But for adults, you're probably going to have to schedule just a routine eye exam. Now for patients with diabetes, history of eye disease, glaucoma, high blood pressure, or other heart problems or cardiovascular disease, you're probably going to need to do more regular eye exams. For example, patients with diabetes need a once-a-year eye exam. It doesn't matter how old you are. Depending on what eye disease you have, maybe twice a year or maybe once every couple months. If you already have glasses or contacts, so that's most of the patients I see in the clinic, it's not the first time they are using glasses or contacts, or if you've had surgery for vision correction. So you'll need more regular exams. If you are a glasses wearer, I'm okay in this 20 to 30 age range. If you're seeing okay, as often as you need to replace your glasses, yeah, maybe around 40 we'll start checking things every couple years. Contact prescription is valid for 1 year, so that changes every age. If you're a contact wearer, you're checking things once a year. Patients that had LASIK, so if you had high myopia and you managed to have LASIK to correct that, now you can see clear far away, but you still have an unhealthy retina that has a risk for detached retina. So these patients will still need to do the routine checking once every year, every 2 years. So the cause of myopia, the cornea, is the clear dome-shaped surface on the front of your eye. The lens is the clear structure about the size of an M&M. In order for you to see, light has to pass through the cornea and lens. They bend the light so that light is focused directly onto the retina at the back of the eye. This tissue translates light into signals sent to the brain, which enables you to perceive images. Okay, refractive errors, nearsightedness or myopia is a refractive error. This problem occurs when the shape or condition of the cornea, the shape of the eye itself, results in inaccurate focusing of the light passing into the eye. Nearsightedness usually results from the eye being too long. It may also result from the curve of the cornea being too steep, or sometimes we say that's too strong. These changes result in light rays coming to a point in front of the retina and crossing. The messages sent from the retina to the brain are perceived as blurry. Other refractive errors, hyperopia or farsightedness, astigmatism. Risk factors for developing myopia, genetics. Nearsightedness tends to run in families. You have increased risk if your parents have that. If both parents have that, it's more increased still. If you do a lot of up close, a lot of reading activities, that's associated with an increased risk of nearsightedness. I think that kind of goes along with screen time. I don't make a distinction between what you're looking at up close, if it's a book or a paper or a stamp or a cell phone or a tablet. But it's just an interesting idea that when you have a stamp collecting hobby and you kind of set that down, you may walk around or go for a jog. But if you're working or studying something on your tablet and you want to take a break, you might switch over to a different app and watch a video. So you may end up doing prolonged close-up activities a lot longer. I don't think the screen itself, the ultraviolet, is inherently harmful. I think it's just you're much more likely to have prolonged close-up activities when you have a lot of screen time. Some studies support the idea that a lack of time outdoors can increase the risk of becoming nearsighted in the first place. So that is what I will tell patients. If you have a young child that's not nearsighted, spending time outside, looking far away, is a possible thing to prevent them from becoming nearsighted. So complications. So for children, this is very important to me. Poor school experience. Children can experience delays in reading and other academic skills, difficulty with social interactions, and poor self-esteem. Now, sometimes the wearing of glasses itself can be a cause of poor self-esteem, so we might go into a contact lens for a young child that refuses to wear glasses. Reduced quality of life. You can't see things as well. You can't enjoy things as well. Strain on the eyes, squinting, headaches. It's not safe, particularly for drivers or operating heavy equipment. And severe nearsightedness, -6 and higher, it puts you at an increased risk of detached retina, glaucoma, cataracts, other serious medical eye conditions. So this is the Mayo Clinic website for myopia. And this is the last segment for the myopia video. I'd like to go into some examples of how to calculate how much myopia to correct. This is the Goldstrand eye. So this is basically, if you have an eye, again, this is your cornea, that's the shape of the eye overall. This eye is looking to the left. And you wanted to calculate based on, the properties of optics, how strong is the eye from a refractive standpoint. You would have to measure the change in index across each one of these interfaces, as well as the radius of curvature. And so you can see there's multiple interface changes and multiple different curvature measurements. A lot of these, for example, inside the lens, this is more of a gradient of index change rather than a solid index. So it could be quite complicated to do this. So what if we were to develop a simpler system just for the sake of understanding what we're seeing here? So here is an eye pointed to the left. There we have light rays crossing the cornea. They would also be crossing the lens, and they're focusing on the macula at the back of the eye. A nice clear or crisp focus here will send a clear signal to the brain, easily perceive what you're seeing really far away. Here I'm trying to convert this eye system into sort of a simple geometric optics situation. So let's imagine that right here is a lens, and that lens is able to bend light so that it crosses the lens and focuses perfectly 24 millimeters behind the lens. So the focal length of this lens is 24 millimeter, and the power of that would be the reciprocal of this. So 1 over 24, but we need to convert millimeters into meters. So that ends up being 41.6 bar diopter sphere. So this eye that has this length, that has this power, is able to focus clearly on the retina and see things far away. Now let's simplify this by removing the cornea, and let's remove the eye. And what we have is just a lens that's focusing on a screen 24 millimeters behind the lens. And again, that power needs to be 41.6 bar in order to focus it clearly. Now here's a situation where we have light coming from far away, focusing in front of the screen. So this is similar to the problem of myopia. In this example, we still have 24 millimeters from the screen to the front, but this light comes into focus at 12 millimeters. So we first want to convert 12 into meters. So that's 0.012 meters, and we take the reciprocal, or 1 over 0.012 meters. That equals positive 83.3 bar diopters. So the power of this eye is 83.3, but it's too strong. We need this to focus further back out here. So we need to introduce another lens right in front of this one that has some power, call it power P, that we're going to add that lens to our system and end up with a system that focuses on the retina. So that's what we have here, power P on this lens. We add this lens plus this lens, P plus 83.3 bar. We know this must equal 41.6 bar in order for the light to be focused at 24 millimeters. So we can subtract 83.3 bar. We end up with the power of our lens necessary to focusing this light back on the retina as 41.6 bar diopters. That's minus power. That's a diverging lens. That's always what a patient with myopia will need, is a minus powered lens. Now this is an extreme example because I've never prescribed minus 41, but here is a more common situation where the system has a power of 43.6 bar. Again, this needs to be focused at 24 millimeters. This is actually very close to 23 millimeters, so it's a more realistic problem. Now what lens, right now we have 0 here, but what lens would we add here in order for this to be equal to 41.6? That would be a minus 2. So this would be the situation of a minus 2 myope. And so that's what we're doing. We're just bending the light to focus it back further onto the retina. And here's some optics examples. I have patients always asking questions about that. And so here I have that broken down for you a little bit more clearly. That's everything that I wanted to say about myopia. The next conversation in the series here really should be about myopia control. There's new things we can do to slow down or stop the increase of myopia that normally occurs during your teenage years. During your childhood up till about 20 years old. So the next video will be some of the more information about myopia specifically in regards to that. Thanks for tuning in. Thanks for watching this whole video, and I look forward to seeing you if you're a patient and coming back checking things again in the future. All right, thank you. Bye-bye.